Is your newborn crying for hours and you just can't figure out why? You've tried feeding, changing diapers, rocking, but nothing seems to work. If this sounds familiar, you're not alone, and you might be dealing with something called infantile colic. In this video, I'm going to explain exactly what colic is, why it happens, when it's normal, when you should be worried, and most importantly, practical things you can do at home to help soothe your baby. So if your baby's constant crying is leaving you exhausted and stressed, make sure to stay until the end of this video, because it might change the way you handle colic forever. Hello everyone and welcome back. Today we're diving into infantile colic, a condition that affects many babies in their first few months of life. It's one of the most common reasons parents visit the pediatrician, and while it can be exhausting and stressful, the good news is that in most cases it's harmless and temporary. But there are important warning signs that parents need to recognize. We'll also explore practical, step-by-step strategies that can actually help calm your baby. What is colic? Colic is defined as excessive, unexplained crying in an otherwise healthy infant. The role of 3 is the classic description: more than 3 hours a day, more than 3 days a week, and for at least 3 weeks. It usually begins the second or third week of life, peaks around 6 weeks, and gradually improves by 3 to 4 months. Most cases resolve completely by 6 months. Possible causes. The exact cause is unknown, but theories include digestive system immaturity, gut is learning to work, leading to gas, bloating, or sensitivity. Second is swallowed air during feeding, discomfort if not burped properly. Next cause is gut bacteria imbalance. Some babies respond well to probiotics. Food sensitivities, cow's milk protein or caffeine in breast milk. Overstimulation and immature nervous system. Important, it is not caused by bad parenting and does not mean the baby is sick. When is colic normal? It's considered normal if the baby is feeding well, gaining weight, and otherwise active. The crying is at predictable times, often late afternoon or evening. There are no other symptoms like fever, vomiting, diarrhea, or lethargy. When to worry? Colic itself is harmless, but certain symptoms mean it's not colic. Fever in a newborn, always an emergency. Persistent or green, that means bile stained, vomiting. Bloody or jelly-like stools, possible intussusception. Poor feeding, dehydration or weight loss. Constant irritability with no breaks. Difficulty breathing, bluish skin, or lethargy. Now let's speak about conditions mimicking colic. That is, some dangerous diagnosis includes infections like UTI, meningitis, sepsis, and about GI emergencies, something like intussusceptions, volvulus hernias, severe GERD, eye problems, corneal abrasion, and trauma. Babies with colic should always be checked once by a doctor to rule out these causes. Now we want to speak about management. Feeding related strategies ensure proper latching to reduce swallowed air, burp after every feed. You can use over-the-shoulder method or sitting and leaning forward while supporting the chain. Smaller, more frequent feeds. If formula fed, hydrolyzed formula may help. If cow's milk protein sensitivity suspected, be cautioned that doctor's advice needed. Management. Positions and movements. You should comforting positions and movements. Swaddling, snug wrap with a light blanket. Tummy time across lap. Baby face down across knees, gently rub back. Colic hold. Baby face down on forearm with head supported. Rhythmic movement, rocking, stroller rides, gentle bouncing. Another choice is short car rides. Next one is white noise. White noise can mimic warm sounds, household sounds, fan vacuum, hair dryer, washing machine. White noise apps are machines with a heartbeat, rain, or ocean sounds. Next thing is evening routine. Dim lights, quiet space, avoid overstimulation. Tummy massage, gentle clockwise circle. Imagine that this is the abdomen of your infant and you should massage like this. Be careful yet that you should do this very gentle. You can use baby oil to do this. This type of massage is because of the anatomy of the intestine. Leg bicycling. Move legs in cycling motion to release gas. Warm bath for relaxation could be helpful too. Management medications. Medications and some supplements like simethicone drops is safe but evidence limited. Probiotics may help breastfeed infants. Gripe water or herbal remedies not well supported, only use with doctor advice. Never use OTC meds without pediatric consultation. About parental support, supporting parents. Colic is not their fault. Okay to place baby safely in a crib and take a short break. Share care responsibilities if possible. Parents should seek help if feeling depressed, angry, or unable to cope. Prognosis colic peaks at 3 weeks. Colic peaks at 6 weeks, improves by 3 or 4 months, and usually resolves by 6 months. It causes no long-term harm or developmental issues. With time, this phase will pass. Conclusion. To wrap up, colic, excessive crying in healthy infants, usually harmless and temporary. Red flags are fever, vomiting, jelly-like stools, and poor feeding. Management is feeding adjustments, burping, soothing positions with white noise, massage, probiotics. Parents need support too. Thank you for watching. Please like, share, and subscribe for more medical content. I am Dr. Jamalvandi. Thank you for watching.